What we're about to show you is probably going to shock you. A woman is having an operation on her brain while she's wide awake. It is a confronting procedure to deal with the crippling Parkinson's disease. There's no cure, but this radical treatment has managed to switch off some of the effects. Emily Rice reports.
Karen Spielberg is tackling Parkinson's disease head-on. Just minutes away from brain surgery at the Monash Medical Centre, she's wide awake and happy to chat.
So how are you feeling this morning?
Not too bad, thanks.
The Melbourne mother of two is undergoing deep brain stimulation, a radical operation to insert electrodes into her brain to block the nerve signals that cause Parkinson's. Karen was diagnosed with the condition 9 years ago. It causes her muscles to stiffen. Then the medication she takes to loosen up creates exaggerated movement, so she can't stand or sit still.
We'd like to try and reduce these involuntary movements that she feels on an hourly basis on a normal day at the moment.
I just want to get the most out of life, so if something can help me, why not?
Behind a sterilisation curtain, neurosurgeon Dr Andrew Danks opens up her scalp and bores 2 holes to insert the electrodes deep into her brain. He's guided by measurements from earlier scans. On the other side of the plastic wall, neurologist Professor David Williams is talking to his patient.
This is where you'll be nice and awake now, Karen. You can join us at the party.
Okay.
And she will remain conscious throughout the procedure.
While Karen isn't exactly comfortable, she's certainly not in any pain. Her body is awake, but her skull area has been anaesthetised and the brain doesn't have any pain receptors.
As the electrodes are carefully inserted, static noise can be heard. It's the sound of neurons firing in Karen's brain.
And how hard is it to hit the spot, so to speak?
Well, you have to be very accurate. If you're 2 millimetres out, you'll get adverse side effects and the patient's response will be limited.
At the moment, the brain's telling us we're in the right spot. Professor
Williams constantly checks on her hand-eye coordination, and it's all on track.
Poke your tongue out. Yep. You say the days of the week nice and loud for us.
Monday, Tuesday, Wednesday, Thursday, Friday.
Okay, getting any tingling?
Sunday, no.
The electrical current is slowly increased, modifying the neural activity that causes Karen's muscle stiffness. Already there are signs the deep brain stimulation is working.
Well, at first her movements were very stiff, and when Dr Williams was examining her, they were slow and stiff, and later on the movements became quite rapid and normalised.
We're really happy with the operation today. She's already shown improvement in the muscle stiffness and the speed of movement.
But the treatment doesn't end there. The electrodes will be left inside her head and attached to a brain pacemaker. When activated, it will send electrical pulses to her brain for years to come, hopefully reducing the symptoms of Parkinson's disease.
And we're just going to a precise point and we're leaving an electrode there which then can be adjusted in a very refined way.
2 weeks later, the brain pacemaker is switched on and the improvement seems miraculous. Karen is able to sit still for the first time in years.
Her involuntary movements have substantially improved, and she doesn't feel any of those wearing off symptoms where she finds it difficult to walk or stiffen up. So that's a really good sign for her.
Deep brain stimulation isn't a cure for Parkinson's, but will improve her quality of life.
On Sunday, August the 28th, Karen will take part in the Parkinson's Unity Walk along the Yarra River in Melbourne. It's to raise awareness of the disease and money for research, and to prove she won't let Parkinson's keep her down.
Even at the worst times, I've never let it get the best of me.
That report from Emily Rice.